Welcome to Medicare for All Explained. This podcast will enlighten our listeners and dispel the distortions that surround Medicare for All. Medicare for All Explained is produced in collaboration with Physicians for a National Health Program and is hosted and produced by Joe Sparks. I'm your host, Joe Sparks. This is episode 117. Will healthcare get worse in the United States? The question is, what will Trump do with healthcare? He obviously doesn't have a plan, or as he put it, he has the concept of a plan. Well, he had over 8 years to come up with a plan, and he hasn't. I am not a fan of the Affordable Care Act, also known as Obamacare. But one of the good things that it did is it allowed people to get insurance who had pre-existing conditions. As an aside, the United States is the only country that calls them pre-existing conditions. Other countries call them medical problems or health problems. Getting back to Donald Trump and what he will do on healthcare, if the previous record is any indication, he will make healthcare even worse. Previously, he tried to eliminate the Affordable Care Act. And one of the things that he proposed was short-term health policies. These are policies that do not provide necessary coverage. And while they may be cheaper than current policies, people often discover that they do not cover what is needed, and expenses will be out of pocket. The other thing that Trump wants to do is he wants to move people from traditional Medicare to Medicare Advantage. This podcast has, on several occasions, stated the problems with Medicare Advantage, which really shouldn't be called Medicare. It is just private insurance. And Medicare Advantage has all the disadvantages of private insurance. If you get sick, Medicare Advantage often fails to meet the needs of the patients. It has high out-of-pocket expenses, and Medicare Advantage companies often deny care, even care that is required to be provided under Medicare. In fact, it has gotten so bad that many hospitals and healthcare systems are refusing to take certain Medicare Advantage plans because either their payment rates are low or they deny so much care. The other problem that will happen with Trump is that he will try to introduce market forces into healthcare. And let me say, the competition does not work in healthcare. We've known that since 1963, when Kenneth Arrow published his paper, Uncertainty and the Welfare of Economics of Medical Care. There is a reason why 32 out of 33 developed countries have universal healthcare programs. It's that when they left healthcare to the free market, it didn't work. People did not get the needed care. And in the United States, the reason we have Medicare is because health insurance companies did not want to insure older patients. So, will healthcare get worse under Donald Trump? I think the answer is an emphatic yes. If Trump succeeds in getting rid of the Affordable Care Act, it is likely that there will be no good replacement for it. And if that happens, in spite of all the problems with the Affordable Care Act, healthcare will become even more unaffordable. And our health outcomes in the United States are likely to get even worse. And as it stands now, the health outcomes of the United States are often the worst for developed countries. Of course, the way to make healthcare better in the United States is with a single-payer Medicare for all system. While that does not seem to be in the cards at present, we must continue to work for that so that healthcare actually improves and people can get healthcare in the United States without worrying about cost. Remember that health insurance does not equal healthcare. Too many people have health insurance, but they are underinsured and they still cannot afford to get healthcare. So if we really want to improve health outcomes in the United States, we need single-payer Medicare for all. Thank you for listening. You have been listening to Medicare for All Explained. Remember to tell your family, friends, and colleagues about this podcast. Information about Medicare for All Explained can be found at our website, medicareforallexplained.org. The music for this show is Super Bubbly by Jesse Spillane. The logo was created by Lily Sparks. Thank you for listening.